A new report from the American Heart Association is shining light on the greatest killer throughout the pandemic, cardiovascular disease.
Kyle Beachy spoke with two cardiologists about these troubling statistics, and I think this will surprise people that it was cardiovascular disease.
It was definitely a surprise to me when I spoke to both doctors today. Heart disease and stroke, the leading cause of death in 2020, not COVID. But the issue goes a little deeper than just cardiovascular health.
These things tend to correlate with socioeconomic status and racial lines. It's something that we've seen in medicine, not only in cardiovascular disease, but in many other diseases.
The report says more people died from cardiovascular disease in the first year of the pandemic than any year since 2003. More than 928,000 people in 2020. And it hit the Black, Hispanic, and Asian communities the hardest.
These populations were the ones that were underserved in terms of receiving the COVID vaccines, underserved in terms of access to care around the time of COVID.
So what is being done to close the gap?
So there's a lot of efforts across the country in improving access, but it's not enough yet.
There are certain groups of people that are more suspicious of healthcare providers. And are more, I should say, less willing to seek healthcare when the time is right. This really got exemplified during COVID.
These doctors say education and building trust is key.
Doctors are in this to take care of patients. Providers are in this to take care of patients. We care about you, and we care about your cardiovascular health.
The rest is rather simple. The first step, get a yearly physical. Don't ignore symptoms, eat right, and exercise more.
You can't take care of anyone else unless you take care of yourself. So that's the thing that we need to remember.
Cardiovascular disease is the #1 killer in the United States and in the world. And it's going to be probably for the rest of our lives. So don't ignore it.
In that report, it shows the rate of heart-related deaths going up, even though the average age of a patient went down. Usually those numbers trend in the same direction. Colleen?
That's